Hi everyone, Dr. Fink here. Today we'll talk about the health risks of growth hormone. So again, quick disclaimer, this is not medical advice, this is just entertainment. For those with a medical condition, please consult your physician. So in the fitness industry, growth hormone is widely used for performance enhancement, to burn fat and to build muscle. And it is mostly considered having low side effect risks. However, there are some side effects I want to point out today and talk about those. So growth hormone, first, as the name says, will make everything grow. This means that your bones will grow, your organs will grow, and this can have detrimental health effects, but it can also have aesthetic bad effects on your aesthetics, how you look. Okay, you don't want to walk around with huge fingers or with a big forehead, for example. So this is for growth. Then growth hormone will also be transformed into IGF-1 in the liver, insulin growth factor 1. So once it reaches the liver, growth hormone is transformed into IGF-1, when IGF-1 actually is helping with cell proliferation. Cell proliferation means it helps the cell to multiply, which is pretty good for muscle hypertrophy, for example. But in case somebody has cancer, let's say there's cancer cells in the body without even knowing it, these cancer cells can then spread, and this can be accelerated by taking growth hormone, which is transformed to IGF-1, and IGF-1 is triggering this multiplication of the cancer cells. So for those who have cancer or are at risk for cancer, growth hormone is a very bad idea. Lastly, one side effect that is sometimes overseen is the insulin resistance that growth hormone can basically induce. So growth hormone is reducing a molecule called GLUT4. Okay, so let's say we have a cell here, and now we have a sugar molecule here, and here we have our GLUT4 molecule, and this GLUT4 is basically going to go here to the cell membrane and help to transport the glucose into the cell. But with growth hormone, GLUT4 expression goes down, so it is harder for the glucose, for the sugar, to get inside of the cell. So what happens, we are using more free fatty acids instead for energy. So we're relying more on fat rather than sugar. So that's good to burn fat, but what happens is in our blood, we have a lot of glucose accumulating. Okay, so this can actually lead to diabetes. So what a lot of bodybuilders tend to do if they use growth hormone, they tend to use insulin with growth hormone. Insulin does what? It takes basically the sugar, the excess glucose from the blood, and transports it into the cell. So this is these are the main side effects of growth hormone, and as you can see, they can be very harsh. It also depends on the dosage and the duration and the genetic predispositions of each individual. Side effects can be very low, but they can be very, very harsh. As you can see, for example, with the IGF-1 increase and the growth, the multiplication of cancer cells, and the growth of organs if the dosage of growth hormone has been excessive for a certain period of time. And again, the impaired glucose metabolism, so how well we can use sugar and prevent the accumulation in our bloodstream, preventing diabetes, is also something that can be counteracted with the concurrent usage of insulin. But keep in mind that growth hormone has side effects which should be monitored in case somebody is taking growth hormone for performance enhancing goals. Thank you for watching, and I hope this video was helpful.